The USMLE is becoming more and more integrative in its approach to medical education. What do we mean by that? If we analyze the way the questions are asked, they sit on three platforms: content, context, and application. The student must be able to integrate all of the branches of basic sciences in order to apply this knowledge to clinical resolution of problems. The mind maps help the student to integrate organ-based system and at the same time, not just integration, but clinical relevance. For example, the student can follow specific topics within the mind maps. If the student wants to study hypertension, he will be able to navigate the maps to go through the basic science to arrive at his understanding of hypertension. We will use this topic, for example, hypertension, to demonstrate how the student can navigate the map and fulfill his learning objectives. Let's start with the big map, cardiovascular. Hypertension falls under this cardiovascular system. And so, starting with the big picture, we are showing the embryology, anatomy, physiology, pathology, and pharmacology involved in the cardiovascular system. But because we want to be subject-specific hypertension, let us go into the physiology, follow the branch on the right. Hypertension falls under vascular physiology, hemodynamics. The student clicks on hemodynamic, and this opens into details to explain the physics and physiology that is the platform of the understanding of blood pressure. And by the way, in each map, as you notice, there is a microphone. The student can click on the microphone, and there is an accompanying lecture to the details of the map to explain, so the student is able to not only be interactive with the map, but also visual and auditory, three-dimensional approach to understanding. In this map, for example, blood pressure, the physics, flow is equal to delta P over R. The foundation of blood pressure is explained on the right. The details of what is R, resistance, the detail of compliance on the right. On the left, then taking this physics, extrapolating to the entire body, where cardiac output is flow, where TPR is the resistance, and mean arterial pressure is the pressure gradient. So the formula extrapolate to the total peripheral system or total peripheral circulation on the top left. We also know that cardiac output is stroke volume times heart rate. We click on that link and it breaks into details of understanding the physiology of this. Here the map is showing on the top right, how do we calculate mean arterial pressure? Pulse pressure. Bottom right, systolic blood pressure, diastolic. This is forcing the student to understand that systolic blood pressure is an indication of cardiac output, and diastolic blood pressure is an indication of total peripheral resistance. So when we measure blood pressure, it's a very convenient and indirect way to assess cardiac output and TPR, cardiovascular system. Now on the left, how does the body regulate blood pressure and how does the body monitor blood pressure? We regulate blood pressure via hormonal and autonomic. We click on the link hormonal and that breaks down into details as the map shows. On the right, the renin-angiotensin system, again the microphone, detailed explanation into the role of each one in regulating blood pressure. Now I've finished this, the student goes back to the big picture, interactive again, and looks at how role the autonomic nervous system plays. Clicks on the link and the role of the parasympathetic and sympathetic is detailed in its explanation. The role of the sympathetic, beta 1, alpha 1, and alpha 2, the role of the parasympathetic M2 receptors. Excellent. Now go back into how the body monitors blood pressure, the role of the baroreceptors. Click on the link and details now appear, and once again the microphone is there for detailed explanation. Now that we've conquered the basis of the physiology of blood pressure, what it is, fundamentally, How does the body regulate it? How does the body monitor it? The student now can go to the big map where he can now understand the pathology of it. The overall map of the cardiovascular system now will bring us to the pathology. We follow pathology and we see under vascular, hypertension falls under vascular. We click on the link for vascular and it opens up to give the details. Now this looks like a map that may scare you in the beginning, but when we look at it on the right, and once again, don't forget, click on the microphone for details. If you follow the map on the right, it breaks down into the link that we can look at to see the details of the pathology of hypertension. We click on that and it opens up into this detailed map. The reason why it's so detailed, we want the student to have first the big picture. I like to call that the elephant in the room. The overall, everything. As you can see in this map, on your right, we start. What's the role of the heart to blood pressure? What's the role of the kidneys to blood pressure? The renin-angiotensin system, the details are there, linking. Then at the top, we have environmental factors, we have genetic factors, and then on the left, pathology in the arteries that can lead to hypertension. Now, this is a vicious cycle. The students must bear in mind, and the map and the lecture will bring out that not only there are pathologies and environmental factors and genetics, etc., that can lead to hypertension, but hypertension itself, as the map shows, can lead to these pathologies, a vicious cycle. Now let's go to the left, the arteries. We break it down. What are the factors in the arteries that can lead to hypertension? Endothelium factors, deposit factors, fibromuscular thickening, and now the student can follow the link. For example, we have deposits, mainly three things: atherosclerosis, monkey bag, and hyaline arteriosclerosis. It's important that the details, when we click onto these details, the student is able to differentiate between atherosclerosis and arteriolosclerosis, and also differentiate also between fibromuscular thickening. The details are then explained as the student click on the individual links. Let's do one, for example, atherosclerosis. We click on that. And what do we see? Here the map explains the details. On the right, what risk factors are responsible for atherosclerosis? What are the consequences? And importantly, at the bottom, the pathogenesis. So the student is now getting into the depth of this pathology. Very good. Now let's go back to the follow the link. For example, big map. And we can see now that the student is able to, after conquering the pathology, he's now able to go safely into the management of blood pressure, which is the pharmacology. Here's the link. On the left, antihypertensive. We click on that link and the overall big picture. Always, understanding comes from seeing the big picture before going into the details. In other words, I like to call this 3D. Our brain has X, Y, and Z axis. It's important to give it the big picture before we go into details. Sometimes, unfortunately, in reading a book, we go from details and the big picture is not well connected. This problem is solved here. In this pharmacological approach, we see on the right, how do we approach factors of the heart? When the heart contribute to hypertension, the brain contribute, the kidneys, and on the right, the links are there. For example, heart, top right. How does the heart contribute to blood pressure? Heart rate and stroke volume. So we look at beta-1 blocker, calcium channel blocker. Clicking on the link for beta-1 blocker will give details of beta. Let's click. Let's have a little peek into the room of beta-1 blocker. Here it is. The student clicks on the link and the map opens up into details. This map places before the student the big picture of beta blockers. On the right-hand side, we have non-selective beta blockers. By non-selective, we mean drugs that work both on beta 1 and beta 2 receptors. The details are to the right of each one of these non-selective drugs, non-selective beta blockers. On the left-hand side, top left, we have selective beta 1 blockers. These drugs mostly affect beta 1 with very, very little or insignificant effect on beta 2 receptors. On the bottom left of the screen, we see mixed blockers. And by mixed blockers, we mean those drugs that not only block beta receptors, but also block alpha 1 receptors. And of course, those drugs are listed for the students to explore and enjoy. So let's go back. On the map is showing on the left factors that affect TPR, which is diastolic blood pressure. So we have those that are direct smooth muscle relaxants, and at the bottom, those that work on angiotensin 2 and angiotensin 2 receptors. In this short presentation of the mind maps, we want to demonstrate the integrative approach to medical education and how the mind maps allow the student not only to integrate across the basic science in specific topics of organ system, in this case cardiovascular, but also within the big elephant or within the big picture, the student can home in into specific topics and still integrate his approach, still be interactive with his approach to understanding, but in a fun, interactive way that at all times put the information at his fingertips. Content, context, the understanding of the content, its application. This provides what I call the global approach or the three-dimensional approach to medical education. We feel very strongly that this is the way the USMLE requires the student to approach medical education.